And it's my pleasure now to bring onto the stage our wonderful colleagues for the next panel that we're going to be discussing a recommendation that's contained in the blueprint around a caller's Bill of Rights. My colleague Madge Haynes will be facilitating this panel. Madge is the senior manager of engagement and partnerships at the Full Frame Initiative. Full Frame, as you all know, is a key partner in Transform 911. With her on the panel will be Richard Ray, Moki Macias, Goode, Yana Calou, and Ashley Tjaden. And they are making their way here as we speak.
Hello again, and I know you've heard it a number of times today, but I'm going to repeat it. We are very thankful that you joined us today. It's a very exciting day, and we're excited just to be here at this moment after all of the work that has been done on this project. My name is Madge Haynes. I'm the Senior Manager of Engagement Partnerships with the Full Frame Initiative. We are a social change organization founded in 2007 out of Massachusetts. And we have a North Star that this country be a place where everyone has a fair shot at well-being. And so it's been our pleasure and our privilege to be involved in this project and to partner with Rebecca and the rest of the team at the University of Chicago Health Lab, all of the co-workers, meaning the co-chairs, and the work group members in this incredible effort. And so I am so honored to be in this space with these panelists who share this stage with me right now. And each of them have contributed greatly to the blueprint that we are sharing with you today. So they will introduce themselves in a few moments. I think you've already heard their names as we were walking in. I will just share their names so that you can see who they are, and they'll take a few more moments just to introduce themselves more officially. We have Goode, the Executive Director of Choose 180, Moki Macias, who's the Executive Director of Policing Alternatives and Diversion Initiative, Ashley Tjaden, who's the Business Services, Equity and Diversity Coordinator for the Bureau of Emergency Communications, Richard Ray, FCC Disability Advisory Committee and NENA Accessibility Committee member, and Yana, Calou, Director of Advocacy at Trans Lifeline. So you may be wondering, what is Caller's Bill? Well, you will hear about an example during one of our planning discussions with a group of the co-chairs. We were noodling together, trying to figure out what might be a mechanism that could facilitate trust and partnership between community and ECCs. The idea of a caller's actually, and here we are today. But we know in order to get to a caller's Bill of Rights, we have to hear from community what their needs are and what need to protect. Okay? I thought it was maybe just my ears and I was going to ignore it. Thank you. And we know in order to get there, community engagement and partnership is key. So our panelists are going to share a little of what they see, what they hear, what they know, and what they live as it relates to listening to what community needs and understanding what needs to be protected and assured. So let's dive right in. Panelists, I'd like you to first share a little bit about yourselves, who you are, the work you do, to help the audience to understand the perspective that you're bringing to this conversation today. And Ashley, will you start us off?
Thanks, Madge. Good morning. My name is Ashley Tjaden. I'm the Equity Coordinator at the Bureau of Emergency Communications in Portland, Oregon. I come from a multinational, multilingual, and multicultural family, and I'm pleased to be working at our local 911 center as our Equity Coordinator. For the past over 10 years, I've been working in critical services to make sure community is at the center and that we do our service delivery equitably. Thank you.
Thank you, Ashley. And now, Sean.
Hello, everyone. My name is Sean Goode. Most important, I'm married to the most amazing woman in the world. I have the fortune of 2 children, Samuel, who's 20, Hope, who's 14. I'm a connoisseur of dad jokes for those that have been in the co-chair meetings with me. And I steward a nonprofit in our community of Seattle, Washington called Choose 180, where we work to transform systems of injustice and support the young people who have been disproportionately impacted by those systems. In this journey, I've been the co-chair for the Alternative First Responders Group, where we co-labored together to infuse innovation and center community voice in a process of leaning and learning and growing together to culminate in a place where we can truly imagine an equitable and earnest response that honors all. Thank you very much.
Thank you, Sean. And Richard.
Hello, everyone. Good morning. I'm going to use this microphone here because I'm deaf, and so the sign is if my hands are right, I'm deaf. My name is Richard, and I'm retired from Los Angeles Technology and Access Coordinator. I've worked with Choose for 6 years, 2 last year. Now I'm focused on access for all at all levels, for government people who are deaf, hard of hearing, deaf, blind, speech and visually disabled. So we talk about issues with technology as it is new technology, and so that's who I am today. And so I'm grateful to be immersed in the emergency world.
Thank you, Richard. Moki.
They do not make these chairs for short people. Good afternoon. It's such a pleasure to be here today. I'm Moki Macias. I'm the Executive Director for Policing Alternatives and Diversion Initiative in Atlanta, more affectionately known as PAD. And I would just like to take a moment just to speak to what we do with PAD, because the work that we are talking about here today is work that we have been trying to do locally in our city over the last 5 years in providing an immediate alternative to arrest for people who are detained by law enforcement, and now more recently providing an alternate response through our 311 line so that people don't have to call for police response altogether for quality of life concerns. So all that to say that we have been kind of living and breathing much of the conversations that are happening here today. So I really appreciate being in this space and how much that I've learned from so many of the people in the room that is really bringing home a lot of the work that we've been doing over the last few years. So I'm happy to be here.
Okay, and these are our panelists. So again, thanks to the panel. Oh, Yana. I'm so sorry. Hi, Yana, please come on and introduce yourself.
Good morning, everyone. My name is Yana Calou. I use they, them pronouns. I'm a non-binary trans person, and I grew up between the US and Brazil. For the past 18 years, I've been an organizer and advocate for my communities, so LGBT people, people of color, and workers. So I'm also joining you as someone who works for an organization who takes crisis calls and someone who has called for crisis support. I am really honored to continuously work to earn the trust of my community to serve as Trans Lifeline's Director of Advocacy, where I lead our campaign for safe hotlines to make sure that the support that we receive, specifically in mental health crises, meets our community's needs and doesn't cause more harm. So at Trans Lifeline, we run a community-based alternative to 911, and we answer calls across the US and Canada from transgender people who need support in many situations where feeling suicidal is actually a very normal response to the conditions in our lives. All of our operators also identify as trans or non-binary, so if you call Trans Lifeline, you will be getting peer support from somebody with some shared lived experience that has struggled or still struggles with these things. So I'm grateful to be here and share from this perspective with you today. Thank you.
Now, thank you, panelists, for being here. And the one thing that I really value in working with people is building relationships, and they can forgive you for errors like I just made. So I'm glad I have relationships with all of you so that I get that forgiveness and encouragement. So now we're going to dive into some questions. All right. So the first question is this. A number of comments from a variety of sources were considered in the course of developing the recommendations for the blueprint. The concept of centering community was not familiar to some. Describe what centering community means to you, why it is important, and how it will affect transformation in the emergency response system. Sean, we would like to first hear from you.
Thanks for that, Madge. I was subtly distracted. I think it's important that folks understand the mechanics of what's happening here, because some of us wanted to be able to use this platform. We wanted to make sure all of us were using the platform regardless of need. And so as you see us move back and forth kind of in this clunky way, that's what's going on with great intentionality. And that's as much for my friends in the back that were like, why aren't you using the microphones, as much as it is for all of you in the audience. I begin my introduction centering like my family and my desire to use dad jokes, because it's significant that we ground our humanity in all of these places and all of these spaces. So often when we show up as professionals, we put on our professional hats and we begin to do our professional speak. And what we do in that process is begin to diffuse our lived experience as if that part of us doesn't matter. What matters is what we've been able to achieve academically and the experience that we've procured professionally. When in reality, like, all of us who have accessed 911 at any given moment of our lives are a professional at exercising this particular waypoint in these urgent moments. And for us to have that voice, to have that experience, to have that perspective, to have that orientation centered in a process allows for a collective vision to be shared that not only helps us operationalize from the need base, but also helps the people who are answering the calls and the creativity necessary to discover who can respond to the calls, all to be centered in that same experience that we can all touch into and share. And so for me, when I think about this need for community engagement and community to be centered, what I'm thinking about is how can we make sure our lived experience outside of our professional spaces takes precedent in a way that allows us to see ourselves as accessing 911, see ourselves as being in need, see ourselves as being on the other side of that response, and what would we like that response to be in our greatest moment of crisis?
Ashley, can you add to that?
Thank you, Sean, and thanks for grounding us in our interesting setup that we have going on that we intentionally did to center our community on stage. To me, centering community means a diverse and trained workforce that reflects the community. Our nation has been facing compassion fatigue, but our people under the headsets don't have the latitude to tune out the trauma. 911 is a national resource, and yet it's highly personal. When you call in crisis, if the person on the other end gets you, it makes a world of difference. Sadly, some of our most vulnerable community members won't call 911 for fear of worsening the situation with an encounter with law enforcement. Over the past several months, I was on the 911 Professionals Workforce Committee. And a lot of folks in public safety out there listening today are likely on board with what we called for: consistent safety and training standards federally. This is because the well-being of the public requires that their calls to 911 be handled by trained professionals whose well-being is also cared for. Additionally, I am calling for the training standards to include community-centered diversity, bias awareness training, and training on hate-motivated mass casualties. I work for the largest public safety answering point, PSAP, in Oregon. but I know that there's rural PSAPs out there that lack support. Just as 911 call answerers may not have had a CPR training, some may have never had a diversity training to understand the importance of the intersection of things like race, gender, and disability on a caller's needs and circumstances, which you'll hear more about in a moment. We need to resolve our systemic racism to attract diverse talent at our comm centers. Professionals will tell you that time under the headset is the best training. And when that's combined with being centered on community, when PSAPs are of and by the community, that results in asking questions with respect. Practically, we need to do right when asking questions like sex assigned at birth, handling reports of missing and murdered Indigenous women, or collecting race information to avoid detaining the wrong person. What does implementing that look like for our 911 PSAP? In Portland, Oregon, we have recently begun incorporating diversity and equity trainings as part of our regular continuing dispatching education program, in connection with the same regular trainings we do on ethics. Finally, at my PSAP, we include in our strategic plan diversity training centered on community and voices to ensure that part of the way we operate is institutionalized over the long haul. Thank you.
They know their orders, so she's not going to move. Okay. We live in a world of technology-driven processes, which in many ways helps us with efficiency and allows us access to information and resources. Yet no matter the capacity of technology, the context and how the technology is used can impact the effectiveness of the technology application, particularly as we rely more increasingly on technology and technological advancements for every aspect of our lives. What do you want to make sure is not overlooked as it relates to community being able to access emergency response services? So, Ashley, do you want to go first? And then we'll have Richard.
Thanks, Madge, and thanks for the question. Technology opens doors, and like all choices, it's people who make decisions and people who are impacted. Therefore, the most vulnerable people in our community need to be centered in these technology decisions. When white product engineers created automatic hand washing stations and even phone cameras, they functioned for white people, but left people with black and brown skin behind when sensors only picked up white skin. The problem was the technologies were created in offices without diversity. When the national ending of 3G service happened earlier this year, we knew this would have an impact on the people surviving intimate partner violence who had secret cell phones donated from DV shelters. Where else do we need to diversify our decisions? For people with disabilities and more, updated and innovative technological solutions are life-saving. When text to 911 using SMS came online, it was critical for everyone, including people who are deaf, deafblind, hard of hearing, or have speech disabilities. And the rising tide lifts all boats. Text to 911 is a tool for times when a voice call shouldn't be made, like intimate partner violence, or when someone is in a hostage or active shooting situation. Yet, as I've said, all PSAPs are equipped and funded differently. And in the US, about 1/3 of the PSAPs have implemented text to 911. Now, I come from an immigrant family, and families like mine, since the beginning of time, have always moved. And when they move, they bring their understanding of critical services with them. 70% of Oregon has text to 911, but we know that not everybody here has that service from where they came from. So what use is the most innovative technological advancement if people don't know about them? Education and outreach to community cannot be overlooked or under-resourced alongside these technologies. We talk about the need to reduce the risk of losing lives when a crime is in progress, supporting the people experiencing intimate partner violence, or when the caller is injured and cannot speak. The first step is, one, getting text to 911 everywhere. Then, doing the necessary multicultural and disability-centered outreach. So again, practical application. Ashley, what does that look like for a PSAP? In Portland, we're currently running our technological program through an equity lens. Our technology leader led our leadership team through a discussion about the digital divide that was made so heartbreakingly clear through the pandemic. And now he's using our equity lens to proactively think through how our new technologies and technologies in progress impact people with disabilities. I invite other PSAPs to also center people in the technology decisions, and I'll now pass it off to my colleague, Richard.
Thank you, Ashley. Thank you very much.
I want to take you on a journey from the beginning when Americans Disability Act, ADA, was first implemented, where we were then and where we are now. And we're hoping to go to a place where we can provide 911 emergency services, understanding that the US has 42 million individuals who are deaf, hard of hearing, and there are people who have speech disabilities. That will be about 7.5 million people. So it's a large number, and those individuals are often overlooked. So when the law was passed, when ADA was passed in 1990, the technology was very limited. It was limited to TTY equipment, teletype equipment. And so when they wrote that in section 3.5.1 to provide communication access for government services through the TTY communication for people who were deaf to be able to successfully communicate, and then 2.562, direct access to emergency services, they use TTY and the modem. So that was two important elements. Understanding at that time, technology wasn't here where it is now. So cell phones and the gamut, that wasn't there. So part of that section, the government was to provide relay services, TTY relay services to hearing people so that they could bridge communication between the hearing and the deaf. And that's the history behind that. And then, say about 2000, in the year 2000, technology started popping up, started emerging, where we started using smartphones. Well, not so much smartphones, but using pagers, and communication began to be reaching to a diverse population. So we were channeling that technology, like the smartphone, for people who were deaf. What happened was many people who started to make that transition were using those technologies, but the services, the landline services were limited because it was expensive. They couldn't pay for a landline and also pay for the internet. And so there was a disconnect. So many people were relying on setting up, who had fixed income, consider that in terms of being able to pay for new technologies. So 2 years later in 2002, the communication services, those agencies were managing communication between the deaf person and the hearing person with interpreters. So they were facilitating communication through these relay centers. And using that service and 911 services, when those communities were like, no, we can't use that, it's not compatible. So we couldn't use that. If we called 911, you had to use the TTY, where many people didn't have TTY equipment, and so they went ahead and were basically forced to change, in some issues, to change the way in which they communicated or received services. And so when providers gave this information out and we started looking at how these relay services would deal with 911 calls, it started to be a challenge because, there was a test call. So I need to thank Los Angeles, the police department in Los Angeles, the 911 center, for working together on this issue, understanding that the issue was a challenge for us, and we want to thank them for testing it out so that we could see what was working for the deaf. And so we had nine test callers. We wanted to see how this system would progress. And at that time, we were using what's called IP numbers. That will replace the 10-digit number. So we did that technology. And before that, we were like, the test with those 9 callers showed at that time access to 911 emergency services through the relay service took about 3 to 5 minutes. So now, we've had it some at 11 minutes. 11 minutes, one call went to 11 minutes. So access to the 911 system was off kilter. So we brought that information to the attention of the Federal Communication Commission that will provide this issue to help set up what's called Emergency Access Advisory Committee. And that I served on that committee with several others for several years. And what that committee was charged to do was to figure out how we could improve access to 911 emergency services. What we've learned from that experience, we did a national evaluation. We evaluated how in the past callers in the past would go through the system and the current calls, and how we wanted those calls in the future to be, what they would look like. And we learned that the community wanted to be able to call 911 using technology that they were familiar with. Nothing to do with circumventing going through a different service. Remember, where that relay service was crazy. They were trying to use a system that many felt was outdated, and so we wanted to be able to call the 911 center and use the technology that we used every day. So what we proposed, we recommended 14 key points. And we made those recommendations, 2 which I'll speak about first. Ashley mentioned it, text to 911. That was one of our recommendations, that this would impact our community who used a text system to be able to use Tech 911 in 2013. That was set up, and we were pushing for that. Next, the second part of the report was VRS. We wanted to have access through emergency services through VRS. So what we were looking at, identifying several different issues that we could provide recommendations to the commission so that they could set these up and make those recommendations to have separate at the different centers, focusing on facilitating communication between the caller, who is deaf or hard of hearing or deaf-blind, and the telecommunication operator. Understanding that in enhanced 911 or emergency 911, the process was getting information on how we could transfer the E911 to the deaf caller. So the new generation 911, we knew that that was important. The reason for that, the reason for that, we needed to have time to be effective in order to access 911 emergency service. And we were waiting like 3 minutes, 4 minutes, 5 minutes. No, that had to stop. So we look back, and now, because of that, we've identified issues in which we can improve, make much improvements on that. And so I commend them. It's not their fault. No, it's not the other's fault. No, it's the system. It's the system. The system just didn't match. There was no match. That was the issue. And so today, we're still not there. It's still not equitable. But for example, with these 2 points that I was bringing up, the time delayed, for example, the time response for them to arrive for 911 is still about 2 to 3 minutes. It's about 2 to 3 minutes today. And it's not the same as for a hearing person, when, the 9 seconds or the 20 seconds, based on that. So keep in mind, that is one difference. The next is recording calls. Many of you at the 911 centers, you record the calls. You're recording those calls that come in. The problem today is that only the voice of the interpreter is what's being called, but not the caller's voice. It's the interpreter's voice that's recorded. And so part of that is not the same. So there's no way to question, or challenge what the interpreter's interpreting on that call. So maybe they interpreted it wrong. That's just one example. And so in Washington State, one woman, a Black woman, she was explaining she called through the relay service. And so it was a DVS person. And so they said, I'm dressed, and they explained what they were, and I'm gonna meet the officer. And when the officer arrived, and when the police arrived there and the caller came, the police had a taser gun. And there was a misunderstanding as to why the police tased the woman because of what was interpreted on the call. It was a disconnect. And so we need to have direct access to emergency communication services so we can avoid those situations, so the caller can see that. The third thing is, and another part of that, we don't have a system that's rooted in the system that's rooted to that provide integral services on a variety of services to have communication access across diverse populations. So the new generation 911 needs to be rooted into that. And so when, for example, a deaf person is communicating with a police officer, they need to connect with the officer, and the officer needs to communicate with the person who is deaf through technology. Technology may not often be available, but new generation 911 is not in some places yet. So that picture, we need to ask the Department of Justice to reevaluate, to revisit those particular sections of ADA so that they are providing newer services, providing new recommendations that once we've looked at this and see how these changes can be made to change the language that will help the 911 industry improve the 911 system that provides its services for the next generation. And so, that's what needs to be passed. Every second counts when you call to 911. A minute, no, a minute's too long. Or, it could mean the difference between life and death. And thank you for that.
Thank you, Richard, and in your time. All right, so the next question is, there is some perspective that the community is not able to be a partner in the emergency response system because they aren't professionals in the system. So what are some ways ECCs can engage community so there can be shared accountability for the success of the emergency response in jurisdictions? Sean, you want to start us off?
Thank you, Madge. I think first and foremost, it's important that we hold that community isn't a monolith. So often we say community, and that's supposed to capture like a collective of people. Particularly in Black, Indigenous, and people of color communities, I regularly tell folks when they're like, well, what is it you want, is the questions that I get asked as somebody that serves in community. And I say, well, if there was a white person we could like nominate as your monolith, like I could bring my monolith representative to your monolith representative, and we could like hash this out over lunch. But that's simply just not the case, because there's a diversity of perspectives within each and every community, which is why it's so imperative that we do the diligence to center the variety of voices that make up the collective us. Now that's laborious. And because it's laborious, it's often easier just to say, well, we're the functional experts in this space. We're going to tell you how it is we function and better educate you on our function. And the better we educate you on our function, the more adept you should be at activating what it is that we do. And that's backward, because what it doesn't do is actually center the end user, right? You're basically informing people on how your product should function, so you should use the product in that particular way. And in the simpler times, when I was a child, I had a Mr. Yuck sticker that I put on all the things underneath the sink. right? Or when I could have my address on the back of my corded phone, so if I was in an emergent situation, I'd be able to tell you where I was. That type of basic analysis could potentially be appropriate. Where we are today in 2022, that no longer is a baseline for where we should begin, but an antiquated perspective that we should look at to say, look how far we can come from there. And I encourage folks to first do asset mapping of what your community really is who are operating in these spaces. And when I say asset mapping, what I mean is like do a deep dive into the rich resources that live within your community, both the organizations and the residents, and the stakeholders that live in those spaces who are likely to be those to activate 911 and want to engage if at all they felt that it was a way that they could connect to emergency services. Then you begin to learn the narratives, you begin to understand the barriers, you begin to find yourself rooted in the nuanced complexities that often keep people from activating 911 altogether. Then you can start creating a product for those people that aligns with the way they'd want to engage 911 if in the case they felt it was appropriate to do so. This type of co-laboring, this type of co-creating, I believe is not only necessary when we talk about 911, but when we talk about community at large. I'll close my comments with this, that as a country, we've gotten to a place where we're entirely too polarized. It's a question of how far can we lean to the right and how far we can lean to the left. And we've missed an opportunity of finding someplace central where we can begin to galvanize and move forward together. That tension is complicated. That tension is complicated. That tension is difficult. But what I know it to be true is this. When I go out into the backyard with my wife and we have our raised garden bed and we plant together, the process of planting and the process of growing has very little to do with the limited amount of fruit that we actually shows up at the end of the season. But it's our time together with our hands in the dirt that grows us closer to one another. I believe we have an opportunity as a country in fertile ground of possibility to plant the possibility of transforming 911. And if we're intentional on all the people that we invite to our planter box, we really could grow something that could become a communal meal that all Americans can benefit from with equity and equality. Thank you.
I keep interrupting people when they're just saying all this brilliance. Richard, would you like to come?
Here, I have a comment. It's very important to have inclusion, people who have disability in the entire process. Because when you understand their role and what their input looks like and the others, that involvement, serve on different committees and councils. When we talk about how we're going to change the industry, we have to understand that part of the 911 centers require that they have experience. Those workers have experience. Those individuals under the microphone, they need to have the experience and they need to place themselves within that disability community. And it is a challenge. It's a challenge that we face with, and I hope that we can change the mindset of these people so that we know that when we talk with a person, say for example, someone who is deaf, when they call a 911 center, they have someone who is educated within the entire community to know how and when and what that caller is saying, so that when they call the 911 center, there's no confusion. They want to make sure that it's clear. And me, as a person, when I go out to the community, when I go out in my community, I'm letting everyone know, that this is not a 911 call center for a person who's deaf. And the important thing is, like for example, text to 911. For the state of California, when we implemented text to 911 in all 58 counties, I was like, whoa, go California. But also, when we get the message from friends who live, like say for example, in Arizona, they have to use text to 911. I got to use it yesterday, and I was thankful to that person in Arizona because it worked. And so when it works in some situations.
Thank you. I think he shared that with you, Chad, in terms of what happened yesterday. Moki.
Yeah, I'd like to just share a little bit from our experience in Atlanta developing the 311 in-person response partnership that we did with our colleagues there. And I just want to acknowledge Director Joy Quarles with 311 and Director Desiree Arnold with 911 from Atlanta, who have been kind of co-conspirators and creators in this process. But when we looked to launch this in 2021, this really, it came out of the result of local and national organizing and mobilizing in defense of Black lives. This was one of the actions that then the city took in partnership with PAD to develop an in-person response that did not, that in situations where we knew police were not needed, that community members could actually bypass the emergency system and use our local 311 system to be able to access a more appropriate response. So our teams would go out and engage the person that may have been called about and try and just navigate with them to what they actually needed. That may be somebody who's experiencing a mental health concern, a substance use concern, or just surviving because they're experiencing homelessness or extreme poverty. But when we set out to do this thing, which we had never done before, we took community engagement very seriously. And so I just want to kind of lift that part of the process up. We surveyed our community. We held listening sessions. My colleague Devin Barrington Ward from Black Futurist Group is here today, who actually helped co-create those listening sessions with community groups all over the city to try and bring people into that process to say, this is new, this is something we are building together, we don't have all the answers. There's a lot of sticky questions about what it would look like to have callers calling 311 for the first time requesting an in-person response versus getting information over the phone, and what does that look like when our teams actually show up. So we really invited people in to get into the sticky questions with us. In addition, we invited folks to join working groups. And these were a mixed group, right? This was folks who had deep experience in this kind of work, and it was community members who just happened to really want to get involved. And so trying to create that diversity of experience in those spaces and really invite people to talk about protocol, right? To talk about how this would actually work, I think was a really important part of not only getting a better result, like Sean said, right? Getting a better protocol, but also building champions along the way. And I think that's a really important part of this as well. Now, for example, we have a caller follow-up protocol. So anybody who provides their contact information, we'll call them back, right? That's one of the recommendations in this blueprint that I don't want people to miss. The idea that if our 911 centers and 311 centers and others were resourced enough to be able to have that follow-up call with people who provide their information, what a rich learning opportunity that would be. How did it work for you? How were you treated in that phone call? What worked in terms of what resource was dispatched? What other resources do you actually want to be able to be dispatched? So it's about having those learning relationships with community members and to create the various ways for people to engage. Not everybody wants to engage the same way or can. I want to just note that people need information about how the systems work, right? That's very important. But then they also need those ways to shape that system. I want to lift up two quick examples for how that might happen. Thank you. So for both 911 and for the resources, though, that are available or should be available, right? We need input on both levels of on all levels of the system. So my colleague, Director Arnold, has been sharing with me, she's leading an effort to develop a constituents 911 academy, right? Modeled after maybe like Citizen Police Academy, but to really invite community members in to see how the ECC functions, and then really start working with them on getting their insight, which I think it's a brilliant idea, and I'm excited to see it happen for our community locally. And then on the crisis system side, my colleague Mary Naom, who's been a big part of this process with T911, and many organizations, some of which are represented here today, have launched a crisis care coalition for our local community, the Fulton Crisis Care Coalition. And they are engaging community members about how the current crisis system functions and how it should function. I think that if we can be talking with people about what they actually want to see in their communities and doing it in robust ways, both at the non-public level, right, within private organizations and within community advocacy groups, and then also at the public level, our institutions actually inviting people in. I really think we have an opportunity to, like Sean so beautifully put, to grow the system together in a more organic way.
All right, thank you. We are at our last question. And so the question is, as alluded to earlier, one central thing for ECCs to engage the community is to understand what callers need and want, which might not match what current processes are regarding how data is shared or how services are dispatched. One example of this is the idea of a caller's Bill of Rights, which is why we're here today. How might this help with building trusting relationships between community and the emergency response system? Yana, will you start us off in this conversation by sharing the effort that you all are leading at Lifeline as it relates to 988? Tell us how it came to be and how it relates to your efforts there.
Thank you all so much, and welcome to my first non-Zoom talk in maybe 3 years. And I just want to say, I just a felt sense in my body of being here with each of you today for my first time venturing out of my little masked house has been really powerful. So learning so much together. And I also want to thank the 911 operators and PSAP workers who work so hard to get people urgent care every day. I grew up in a country that did not have this kind of support. So as I share the reasons for, how and why we came up with this crisis caller Bill of Rights, we're holding the truth that so many people who call 911 or call crisis lines don't always experience harm at the point of contact with that call center or that crisis operator. But often the impact of any harm is felt with other agencies that we put callers in touch with afterwards. That's not always police. It can be police, can be hospitals, can be many other kinds of institutions. When I called 911 last during my father's mental health crisis, the operator made sure that local help was sent to us in a really rural area. Yet my family still experienced the need for the infrastructure afterwards, supporting people that really trusts the people who survive both the crisis and the support intervention, that we are actually the experts in what we need in those crises. So I want to share a little bit more about the Bill of Rights that our campaign for Safe Hotlines developed, even though it's a bit more focused on 988 and not 911, because mental health crisis calls are where our expertise lies, as a hotline that primarily takes mental health calls for our community, answered by trans people. But I think as we prepare for this rollout of 988 in a couple of weeks, we really know that 988 will greatly impact 911, that these systems are really merged together. And I can imagine that, hearing folks in 911 call centers really talking about how they're anticipating an increase in calls to 911 through 988 in the National Suicide Prevention Line. So over the years of providing community-based crisis support without 911 or police at Lifeline, we've created this national peer support crisis model for providing that care that's also free of involuntary hospitalization. And we've done this because the infrastructure that we have for call centers to refer folks to can cause unintended harm to people in these crises. So that's why we brought over 70 survivors of harm during a crisis intervention that was either involuntary or started out as voluntary, but then quickly became involuntary, to ask the simple question: what would you have wanted to happen instead that would have been helpful to you in that situation? This became our crisis caller Bill of Rights. For this work, we defined a survivor as anyone who experienced harm from an intervention during crisis that was non-consensual, right? That they wanted support. The support they got was not what they actually wanted. And I want to explain a little bit about how a non-consensual intervention can maybe start out as a consensual one. So if we think about a single parent who's trans, who calls a crisis line because of a financial crisis, it's leaving that person with suicidal thoughts. The caller might agree with the operator that calling 911 is the best option, and an EMT arrives, not a police officer, arrives and decides that that caller needs to go to the emergency room for their own safety. That trans person's not insured because that trans person doesn't have a job because of employment discrimination. So the ambulance ride and the hospital bill are actually really, really stressful. And once they get there, if they're telling the truth about how they're feeling, that they're feeling really suicidal, they're put into an involuntary 72-hour psych hold. So what if no one goes to pick up their child at school that day? Then that child gets removed from the home. So that support-seeking call with a consensual intervention, yes, I really want help, right? I'm calling for help, quickly turned into something that added extreme difficulty and is following that person for months, if not years. And interestingly, for trans people, having an involuntary psych hold on your medical record, not your criminal record, can lead to you being denied the ability to give informed consent if you're seeking gender-related transition care. And you can say, oh, you're actually not able to give consent for any kind of surgery, any kind of hormone replacement therapy that we might need to actually feel less suicidal, right? And move in the world the way that we need to. So this is why survivors in these systems are the experts on telling us what they need instead, because they're the ones who can tell us what happened after that crisis call ended. So we categorized what people told us into 3 separate areas. We categorized them into safety, transparency, and self-determination. And I'll go through some of these, but you can find the Crisis Caller Bill of Rights if you go to translifeline.org under Safe Hotlines. So under safety, we have the right to trust that the help we seek will be supportive and not harmful. We have the right to receive crisis support that's really free of judgment, irrespective of substance use, participation in sex work, our mental health condition, our disability, our gender identity, our orientation, our age, our race, our citizenship, our housing status, our religion, our nationality, our immigration status, or our caste. And we have the right to reach out for support without being criminalized or detained or deported. We have the right to have all of our trauma responses, including suicidality, be understood as a normal response to current or past traumatic experience and be able to really speak to that without fear of more trauma. We have the right to get crisis support without police violence, harassment, or threats. We have the right to share our identities and experiences without being outed to unsupportive caregivers, workplaces, or abusers. What happens when a minor, somebody under 18 who's trans, calls a crisis line and then 911 gets involved and dispatches somebody? The reason that child is often in crisis is because they don't have supportive caregivers. All of a sudden, that minor is now outed as trans or as queer, as gay, to that unsupportive caregiver, and that's made that situation much worse in their home. And we have the right to transparency. One thing that we hear often is that when people are calling, we've heard about that, people don't know what 911 actually does, how it works. People don't know how a lot of crisis hotlines actually work, right? So we have the right to know what services we're receiving when we call, and we really want clear and upfront information about in which situations do hotlines use police or emergency services, and have that really included on the greeting. Have the operator say, hey, if you share these these are our policies around, if you share these kinds of things with us, these are the authorities that we'll call, these are the agencies that we dispatch. What would you like to talk about today, right? These are ways in mental health crises that we can really let people know what's going on and consent a little bit more to the services that they might receive. And we have the right to be informed if police or emergency services are being dispatched to our location. Oftentimes on crisis lines, the caller is kept on the line while a 911 PSAP is connected, and that caller doesn't know that that's happened, or that maybe police officers are about to show up to your school or your work. So in terms of agency, callers really have the right to determine which supports and care we utilize and which we refuse as the experts in our own lives. We deserve access to support and services without police or emergency responders entering our homes or work without our knowledge and consent, because we didn't call 911, right? This is for 988 and calling crisis hotlines. People are making a really specific decision to not call 911 in that moment, but then when 911 gets engaged without them knowing, folks don't often know that that's happening. And we have the right to make decisions about what's best for our financial and mental well-being, including not being charged those ambulance and hospital bills for services we didn't seek or didn't consent to lose our work, to lose our housing because we asked for help. So these steps came from over 70 survivors of non-consensual interventions who reviewed, added, and made changes to reflect what they wanted from a crisis hotline. Unfortunately, so many centers said that when they've called, they didn't know what kinds of systems were offered, what practices were actually just mandated by law that those operators had to follow, or what could be triggered if they called for that help. We think that should change. We also, in addition to the Crisis Caller Bill of Rights, we just released a fact sheet on the unintended consequences of involuntary interventions, specifically on transgender people, that I won't go into today, but are really important for public safety and behavioral health administrators and legislators to understand. And you should be able to access this also from the blueprint. So to end today with the question of what 911 and 988 can do. First, we need funding for more community-based care and community-led dispatch and response systems like Moki's, like Lifeline. We need to educate callers on what kinds of policies and services and requirements exist when they use our services. And this is part of the reintroducing 911, right? And introducing 988, which is a huge task in front of us. This transparency builds trust. If we know what could happen next is known to us, right? That's where trust comes from. And we need to train 988 and 911 operators on these community-based care models and alternatives that we have that work. We need to transfer calls to communities that can provide that shared lived experience and that peer support. There is still so much more to understand about what people experience after calling crisis lines. It's a challenge for all of us, I think, in 988, 911, all of us who operate hotlines to know what happens to a caller after that call hangs up. So our research team is currently working on a study to better understand the experiences of survivors of these interventions that led to harm that started on crisis lines. So what is the pipeline from a crisis line to that harm happening after the engagement with that line? So if you'd like to receive that report when this is done, you can find that at translifeline.org. That's slated to come out in the winter, probably December, January. So thank you so much for having me here today, and really appreciate your open hearts and minds and all of the work that we're doing to get to the same place together. Thank you.
Thank you, Yana. She's been very generous in terms of sharing their example. And since we were wondering, like, is there a caller's Bill of Rights out there? And there was. And she was allied with us already, so it was really wonderful. Moki, please wrap us up for this.
Thank you so much, and thank you again, Yana. I think bringing that the incredible work that you are doing there with Lifeline. I just want to say, in relation to a caller Bill of Rights for 911, I think that this is an opportunity to explore this in your local community. I think it's an opportunity for emergency communication centers to create a contract with the local community that you serve, who could then advocate to you for what they need, and also who can advocate for you to make sure that you are getting what you need to give them what we need, right? But also to say that, like our National Bill of Rights, this won't be a perfect document, right? But what I think it could do is create a platform for civic engagement, for public discourse, and the community organizing that's required to shepherd the kind of transformation that our communities need and deserve.
Awesome. Thank you, panelists. Our time has come to an end, and so we could sit here for hours and talk with you, and I'm sure you probably would be like, no, we can't. So much information to share. We just didn't even get to touch the tip of the iceberg. But I really do want to thank our panelists. Thank you for your brilliance and your experience, and for sharing with us today and giving us your time. And thank you all for your time and attention. We know, again, like I said, that this is just the beginning of a much longer conversation. And so you will hear a little bit later about some opportunities to join us in future conversations. We are really diligent and really looking forward to how we put the people back in 911, or just put the people in 911. I shouldn't say back. Okay, so next we are going to be treated with a fireside chat. So thank you again, panelists.